Hi there, Dr. Glenn here, and welcome to my webinar about reversing memory loss, Alzheimer's disease, and cognitive decline. And as we get started, I want to ask you a question. What if I told you that there is a proven, scientifically proven way to reverse cognitive decline that you haven't been told about? I know. I've been told the same stuff you've been told. We don't know what causes it. There's nothing you can do about it. It's all a normal part of getting older. Well, that is rubbish. And there are plenty of studies recently published that we're going to refer to some of them where we have documented the reversal of Alzheimer's disease and people are doing much, much better. But before we do, let's just go over some of the conditions that you should be concerned about. One of them is brain fog. And brain fog is when you feel that your brain just isn't working like it ought to. The other is something we call mental fatigue, and that is when you can't do things for as long as you used to. Things like reading or driving. I remember when I was going to college, it was about a 20-hour drive from my house to where I went to school, and we'd just drive all night and not think anything about it. Are you having senior moments? When you use the word senior moments, what I want you to think about is what we're trying to do here is we're trying to disarm something by calling it something cute that can be very upsetting when you think about it. When you reach for a word that you have known your entire life and you can't recall it, or you meet someone that you have known your entire life and you can't remember their names, that's disturbing. Difficulty planning or problem solving, difficulty recalling recent events, depression. Depression is a form of neurodegeneration. It's a brain problem. Withdrawing from social activities. When you're having trouble remembering people's names or words, or you're having trouble following a conversation, you don't really want to be socially interactive because it makes you feel vulnerable. How about confusing times and places and vision issues? Now, I'm not talking about visual acuity for which you might wear glasses, contacts, or something like that. I'm talking about when you have trouble with contrast, like you don't like driving at night anymore because you don't see as well as you used to. That is a problem seeing contrast or shades. That is a brain problem, not an eyeball problem. All of these are signs of neurodegeneration, and neurodegeneration is exactly what it is. Your neuro, or your brain, is degenerating, and these are progressive problems, and we don't like that. Now, as I said before, I'm Dr. Glenn. I went to Baylor University. I taught electrical engineering for several years. I went back to school. I initially became a chiropractor. We moved to Europe in the early 90s where I did a neurology residency program, and I've been doing brain-based stuff like this for my entire career, basically. Let's talk about just a few of the recent studies that have been published. The first big one was published in July of 2022, and there has been another one published in 2023, and then another one published in the middle of 2024. And what these show is that you can actually take forms of cognitive decline, Alzheimer's disease, Lewy body dementia. You can take these things and you can actually stop them and you can reverse them. And this study was just published in August of 2024. And this is a study that went and followed people who had been in the Recode or Reversing Cognitive Decline program, and it followed them over a number of years, and it showed that these people are able to maintain their improvement over a period of time. As a matter of fact, the Recode or Reversing Cognitive Decline protocol is the only treatment that has been scientifically proven to reverse memory loss and cognitive decline. There are no drugs that reverse memory loss and cognitive decline. There are a few drugs, most of them have serious and dangerous side effects that have been shown to slow down cognitive decline, but there are no drugs that actually reverse it. So here's what we're going to cover today. First thing we're going to do is we're going to look at some of the myths that accompany this condition. Then we're going to talk about the things that cause or the root causes of memory loss. We're going to talk about how our program works, and then we'll show you what you can do to get started on your journey to a healthier brain today. Let's start, though, by debunking some of the common myths around memory loss and dementia. And the most common one is that memory loss is a normal part of getting older. I want to change your perspective on that. Right now, roughly 40% of people in North America are diabetic. If 40% of the population is diabetic, I would say that diabetes is a very common problem. But no one in their right mind would say that diabetes is normal because it's common. You would just say it's common. Well, I'm going to say the same thing about memory loss. Just because memory loss is common as we get older, that does not mean that it is normal. So just like diabetes, memory loss as we age is common, but that does not make it normal. And there are plenty of studies out there. This is Rush University Medical Center. Memory loss as we age is not a normal part of aging. Even the Yale School of Medicine says mild cognitive impairment is not normal aging. The second myth we want to take care of is that we don't know what causes memory loss or dementia. This is absolute rubbish. We know exactly what causes memory loss. Ever since Dr. Bredesen, who used to run the Buck Institute for Aging at UCLA, the University of California, Los Angeles, published his book, The End of Alzheimer's, in the fall of 2016, we know exactly what causes memory loss, and anything that can decrease energy production or causes inflammation in the brain will cause the brain to fail. Myth number 3, there is no treatment and there's nothing that can be done. This is not true. What is true is there are no drugs that can treat this problem. But we have a protocol, and these are the results of one of the studies that was done where it was compared to, you can see here, no treatment on the left, and then aducanumab, lecanemab, and donanemab. I don't know who comes up with the names of these drugs. I want them on my Scrabble team for sure. But these are some of the most common new drugs, and you can see that over a period of time, the people that were in this study, they all got worse, with the exception of people that did the Recode program. And this scale was a test called a MoCA test, or a Montreal Cognitive Assessment Test. And over a period of 9 months, the people that were in our program got on average 4 points better on their MoCA test, and the ones that got no treatment got a little over 3 points worse, and all of the drugs got worse. They didn't get as worse as no treatment, but none of these patients, other than the ones in our program, actually got better. And then there's another sort of myth or thing that I want to bring out. I hear this all the time in my office. My doctor said this, my neurologist said that. Well, published in the spring of 2023 by the American Medical Association. So this isn't somebody saying this. This is the American Medical Association says that the average doctor in the United States is 17 years behind the research. Now, the most recent research showing the reversal of Alzheimer's disease and other forms of cognitive decline was published in 2022, which means that most doctors are at least a decade or more away from even knowing about this. I have people say, why doesn't my neurologist know about this? Probably because he's not up to date. I hate to say it. We have this idea in America that we have the best healthcare in the world, which we don't. We have the most expensive healthcare in the world. We also have this idea that my doctor is up to date. He's really smart, or she. They're really smart. They know everything that can be known about the problems that they treat. That's not true. I hate to say it, but it's not true. What we know now is that right now, medical knowledge is doubling every 73 days. It's impossible to stay up on every single thing. So if your doctor doesn't know about this, that's because most doctors don't know about this. All right. Now that we've covered what doesn't work, let's talk about what does work. And that's the protocol that we use here at the office, at the Carroll Institute. It's called the Recode Protocol, and Recode stands for Reversing Cognitive Decline. And a lot of people will ask me, what is your success rate? About 84% of the people that go through our program get better. Now, if 84%, if you're not familiar with medical outcomes, that is unbelievably a high number. We get phenomenal results here in the office at reversing memory loss and cognitive decline. 84% is fantastic. And families helped. I always like to point this out. We now have over 10,000 people that have been through the program. And I say families because unlike any other chronic disease, dementia affects families. And the average person, from the time they get a dementia diagnosis, will live for a decade, will live for 10 years. And that's 10 years of gradually getting worse. And it ends up involving the entire family. It often ends up wiping out savings, money you've put away for the rainy day or for your kids to inherit or your grandkids to inherit or whatever, because memory care is very expensive. Depending on where you live in the United States, memory care can be anywhere from $6,000 to $8,000 a month to $14,000 to $18,000 a month, depending on the quality of the facility and where you live. Now, this is what our program looks like. You can see starting down here in the lower left side, we start off with an intake, we do lab testing, we do a nutritional assessment, we get into fixing the things. We're going to go over some of the things that we fix, and we walk people step by step through the program. And the unique thing about this program is that every patient is unique. And so you have to fine tune the program for each patient. This is completely different than using drugs. If there's a drug, if you've got a bacterial infection and it's a certain kind of bacteria, you get this antibiotic, and everybody gets that antibiotic or so forth. That's the way drugs work. This problem, everybody is just a little different. And that means that you have to fine tune and personalize the protocol for each individual, and that is what is happening with modern healthcare. One of the things that we want to go over as we get into this is there is a completely new way of looking at healthcare, and it is something that is called functional medicine. If you haven't heard of functional medicine, it is the fastest growing specialty or area in medicine right now. And functional medicine is based on this 3-level concept. And we start off with the root cause. Now, I'm going to use a little example because it's very simple and it's easy to understand, and it will be easy for you to remember. Let's say that I sit on a tack. You know, a thumbtack. We don't see thumbtacks very much anymore. But let's say I sat in a chair and there was a thumbtack in the chair, and I sat on the thumbtack and the thumbtack stuck me in my rear end. I would end up with a problem in my body system called my rear end, and it would produce a symptom called a pain in the rear end. You can be more graphic than that if you want to, but this is a very simple concept. The thumbtack is affecting my rear end or my body system. So the root cause of my problem is the thumbtack. It's affecting a body system, and it is producing a symptom. Now, if I went to the doctor with this problem, you would hope that the doctor would have a look at my rear end, find the thumbtack, and remove the thumbtack. Absolutely. That's a simple problem. But as problems become more and more complex, like heart disease, cancer, cognitive decline, these are very complex problems that can have many, many, many things going on. And it's not so easy to identify the root cause anymore. And so what happens is doctors usually end up just treating the symptoms. You wake up every day with a headache. Here, try this medication, see if it gets rid of your headache. You know, your joints ache everywhere. Here, try this painkiller for that, or try this or that. Your blood pressure is high. Here, take this to lower your blood pressure. Not why is your blood pressure high, but here, just take this and lower your blood pressure. So what's happened is, as problems become more and more complicated, more and more complex, doctors don't have the time to go looking for the root causes. So we have a healthcare system now that just treats the symptoms. I don't like it. And I will tell you, doctors don't like it, but it's the problem that we're stuck with. Now, according to Dr. Bredesen out at the University of California, Los Angeles, these are all of the different things that can cause cognitive decline. That's a lot of stuff. And I'm not going to go through each one. And I will tell you, if you have trouble sleeping at night, you can get this list and start going through the list, and it'll put you to sleep right away. But there are all kinds of things in here. Everything from trauma, like trauma to the head, like playing football or contact sports, to hormonal problems, to toxins, to heavy metals, to all kinds of things are in this. Insulin sensitivity, blood sugar regulation, all kinds of things can contribute to cognitive decline. By the time a typical person with memory loss or early stage cognitive decline begins to notice that they're having a problem, there can be 15 or more of these root causes at work. See, what happens is this problem typically begins very, very slowly. And in the beginning, every now and then you can't remember a word. And it progresses very slowly over time until it gets to the point where it overwhelms you. And then you're noticing you're having a problem. People who know you well are noticing you're having a problem. And eventually even people who don't know you can start telling can tell that you're having a problem. But it takes years for this to progress. Now, you might be going along and you're having a little bit of trouble, and then something we see happen a lot is somebody will go in, especially if you're in your late 60s, early 70s, or older. It's very common to see somebody go in for a major surgery. And they were having a little bit of memory loss. They couldn't remember words or something like that. They go in for a big surgery and then bam, just all of a sudden they markedly worse. That is a toxin issue. We see that a lot. We see some people they're going along, they're having a little bit of trouble, then they'll have a major infection and they have to take antibiotics for a long period of time. So you can be going along and then you can have triggers that sort of accelerate it and it can start to ramp up like that. But this is a very complex problem and there can be a number of these things going on in each patient. Now let's take Sammy. Let's do a little patient example here. Sammy came into the office with memory problems. You can see here she was 75-year-old retired dental hygienist. She had a past medical history of HTN, means hypertension, hyperlipidemia. Her cholesterol was out of whack, metabolic syndrome. She was overweight, and she was postmenopausal, obviously. She had a history of APOE4. She had one copy of the Alzheimer's gene, and in her history, she reports that she's had a history of memory issues, including brain fog and word-finding difficulties. She had trouble with her activities of daily living. That's what ADL means. In other words, she had trouble using the shower and buttoning her blouse, so she was starting to have some motor problems. Maybe you're noticing a tremor or something like that. She got to the point where she was too embarrassed to play golf with her friends because she couldn't remember how many strokes she was taking. Nobody likes to be in a situation where their memory is giving them trouble. And so she stopped playing golf, which is too bad. Golf's a great thing for her to go out and do. Her son took her to a neurologist who prescribed for her donezepam and told her, come back when your memory is worse. Now just think about that for a minute. I have no treatment for you. I can't do a single thing except give you this drug that doesn't work. And why don't you come back when it gets worse? Why don't you go ahead and schedule the visit because it's going to get worse? Memory loss is a neurodegenerative disease. It doesn't stop on its own. It always gets worse. So when somebody comes into our office, I have 4 questions that I like to ask. I start off with, first of all, I want to know, how well is your brain working? So we have a test that we do here in the office, and I can even send people, if you don't live close to where our office is, we can even send you a link where you can access this test and take it online. And it's called a central nervous system vital signs test, and I'm going to show you one. And that will give us a good idea of how well your brain is working. Now remember, the brain does a lot of different things, and I always like to use the analogy of a car. Your car does a lot of things. The most important thing is that it can get you to where you need to go and home safely. But your car has headlights, and it has windows that go up and down, and it's got an air conditioning, climate control now because they're all fancy, and you can even do different temperatures for different parts of the car. It's got a hi-fi system. It's got automatic locks. It's got all kinds of things. And you could have a problem with, let's say, the air conditioner, but the car still runs fine. Or the air conditioner might work great, but the transmission doesn't work. So when we look at a patient, we want to know what is going on with their brain, what's broken and what's not broken. Because if you took the car to the mechanic, you say, everything with this car is good, but the air conditioner, and we can fix that, it just needs a recharge or it needs a compressor or something, and then you know exactly what to go and fix. If your brain isn't working very well, we might want to know if it's shrinking. And to do this, we use a very specific type of MRI called a volumetric MRI. And what that volumetric MRI does is it will actually measure each part of the brain and tell you how large it is and how it compares with all the other people your age, how your brain compares to theirs. Because if I only compare you to other people that are your age, you're all the same age. Therefore, if yours is shrinking and someone else's isn't, it's not because of age, it's because of something else is going on. And when you see where the brain is shrinking, then you know where to go looking for the different things that could be causing it. And this is why we run very special labs. We have created our own lab panels with LabCorp and some other labs that are specifically designed to identify which of the holes in the roof, as Dr. Bredesen calls it, the holes in the roof you have. Which one of that long list of things that can cause cognitive decline do you or your loved one or whoever you're watching this video, which ones do they have? Because if we can identify what is broken, then we know what to fix. There's no reason to charge the air conditioner in a car that won't run, because the air conditioner isn't going to run if the engine won't run. So if you identify where it's broken, then you know where to start fixing things. Then we need to know, how are we going to fix you? Because you're different than everyone else. And sometimes we get into running very specific clinical DNA testing. This is not your what we call popular DNA testing like 23andMe. I won't be able to tell you how you should dress for the family reunion, should you wear a kilt or lederhosen or whatever. This is very specific medically oriented DNA testing, and we can actually identify why a problem might be giving you trouble when maybe somebody who grew up in the same town as you, or maybe you have a sibling and one of you is having trouble and the other one's not. Why? Because there could be some DNA stuff going on, and so we can do that. So let's see what this computerized testing looks like. So this is our patient that came to us, and when she came in, you can see here it's called the neurocognition index. It's the 4 with the little red circle around it, and I think it will even pulsate there for you so you can see it. Compared to all the other women her age, she was at the 4th percentile. Now, if you can be anywhere between the 1st percentile and the 99th percentile, being at the 4th percentile is not good. You want to be in the middle or above. You want to either be average or above average for how well your brain is working. Remember, this is not an IQ test. This is how well is your brain working test. It's like the car. How well does the car run? Not how fast can it go, but does it run right? All right. So you can see all these other things in here. You can see your composite memory, verbal memory, psychomotor speed, reaction time, all of these different things. And you can see that she was having some very, very serious issues. So we ran a volumetric MRI. And what you can see here with the MRIs, if you look over here in the lower left, you can see the percentile ranking compared to all the other women her age that have ever had this done. You can see where her different parts, like the superior frontal lobe and the middle frontal lobe. And you can see this inferior frontal lobe on the right-hand side is not in good shape, but the medial orbitofrontal on the left, right, and overall is very shrunken compared to the rest of her brain. It tells you that's where her problem is. So then we know where to go looking to solve her problem. So this is what a volumetric MRI looks like. And I will tell you that in all of the years that I have been doing this, many of my patients are having MRIs run. I can count on one hand over the last 7 to 8 years how many people have had this MRI run. Most doctors are not running the right test. Remember, According to the American Medical Association, the average doctor in North America is 17 years out of date. Okay, so we take our patient and we put her through the program. We've identified where her brain is shrinking. We run the labs. We identify what's causing it. We do a nutritional evaluation. And I always ask people, how important do you think nutrition is? I'm going to tell you, nutrition is the largest tool in the toolbox, and we have had it wrong for many, many, many years. We get her inflammation down. We start getting her doing what we call functional neurology rehabilitation. We're going to talk about something called neuroplasticity. We ended up having to detoxify her from mold because she lived in Florida, and there's a lot of mold in Florida. We get her sleeping right, and we look at sleep and nutrition and toxins. We get her socially involved again. She's back to playing golf. We'll show you a picture of her in just a minute. We take care of any nutrient deficiencies that she had. For this particular woman, she had a very low vitamin D, and she was also not converting thyroid hormone properly. So we do all of these different things, and we get into something called functional neurology or something called neuroplasticity. And we take each patient and we design specific what we call cognitive drills to help that patient rebuild the pathways in their brain that they have lost. So neuroplasticity is the ability of neural networks or the brain, okay, to change through growth and reorganization. It is when the brain is rewired to function in some way that differs from how it was previously functioned. So let me give you an example of neuroplasticity that you've probably seen over and over again. Let's say, for example, somebody is right-handed and they have a stroke in their left parietal lobe. That's this part right up here. Now, if I was going to try and write my name and address down for you, my frontal cortex would tell my left parietal lobe to make my right hand write my name and address. Now, let's just say that I had a stroke in the left parietal lobe and it won't do this anymore. You know what I can do? I can tell my frontal cortex to tell my right parietal lobe to make my left hand write my name. So what's happened is I have taken the brain and taught it how to do something that it's lost the ability to do. And we do that with each and every one of our patients, is we take them, we figure out what isn't working, and we create new pathways to get around that problem. And that's called neuroplasticity. So we do that with this particular patient, and you can see that she's gone from the 4th percentile to the 50th percentile. 50th percentile means she is right smack in the middle of her age group. She doesn't have Alzheimer's anymore. I know what you've been told because it's what I was told. It's what I was taught in school. You can't reverse this problem. Oh, yes, you can. And we do this in our office every day. We take people who have cognitive decline problems and memory loss, and we reverse their problem. And we've got scores, more than scores, hundreds of examples and test results that prove this out. So here we go. We go back to our patient. It doesn't have to take years for significant improvements to be made. She's back out. Sammy's back out. She's back playing golf with her friends. And what we did is we were able to do the right cognitive tests. We did the right blood work, and her overall quality of life, in less than half a year, she's back out there playing golf. We see this in our office every day. So let's talk about where you are right now. Let's say that wherever you are, maybe you're struggling with some words, maybe you're having more serious problems, maybe you've got a tremor, or maybe you're watching this because your loved one, spouse, mom or dad, maybe a sibling is having trouble. Here is the dangerous thing. Wherever you are right now, we tend to think that the future is going to look like this. And it's because this problem progresses very, very slowly for most people. Today isn't a whole lot different than yesterday, and tomorrow is not going to be a whole lot different than today. But here's what happens, and I see this often, way too often. People will come in and I'll say, okay, here's where we are and this is what we need to do. Now you have a choice. You can start today doing something about your brain, and here's what's going to happen. It's going to start to do better. Because that's what we do. In this office, we make people's brains work better. And if you start right now today, I can't tell you, I don't know where you are, that's watching this webinar. But wherever you are today, you can do better than where you are. But people say, well, I don't know. I want to think about it. I want to talk to my doctor about it. That's a nice waste of time. If your doctor is 17 years out of date, what good does it do to talk to them about something that they don't know? Ask yourself this question. If your doctor, maybe your neurologist, if they knew about this and they didn't recommend it to you, what would that tell you about your neurologist? So you have to assume that either one, they don't care, which I doubt that because most doctors are very good, caring people. If your doctor hasn't told you about this, it's probably because they don't know about it yet. Remember, it takes 17 years on average for research to change clinical practice. So let's just say that, I don't want to do anything yet. It doesn't seem to be so bad. So here's what the future looks like. Okay? Remember, these are neurodegenerative problems. Neurodegenerative problems get worse over time. They don't stabilize. They don't reverse themselves. They get progressively worse. Some people get worse faster than other people, but if you've got neurodegenerative stuff going on, you will get worse. So you decide, I'm not going to do anything yet. I'm going to wait a little while. Better than not doing anything at all, but you can never get back the days that you have lost. And you wait a little while longer, and you may do better than you would if you did nothing, but you'll never regain the days that you lose. So what do we do now? What you should do now is you should determine where you are. Everyone should determine where they are. How do you do that? We should see how well your brain is working. How? Do the test. Like taking your car in and just getting it checked out, and take it to the mechanic and let him check everything, and he'll come back to you with a report and say, your front brake pads are getting thin. They're going to need to be replaced. The tread on your tires is getting thin. You're going to need to do something about that. And you probably need an oil change and whatever. And you get this list of things to do. Okay. How did you do that? You took your car into the mechanic and you checked it out. How well is your brain working? Let's run the test and let the test tell us what works well and what doesn't work well. And once you know that, then you can start doing something about it. Who should do this? I always joke about, I have two of my nurses used to work in a gastroenterology clinic doing colonoscopies. And they say everyone should do a colonoscopy. I don't know that there's a line of people wanting to do colonoscopies, but I'm going to tell you what, I think everyone over 55 should be checking their brain and see how well it's working, because every day that you lose is a day that you cannot get back. So what's your next step? Here's what you should do. Call the office. You call the office and schedule what we call a discovery phone call. A discovery phone call is when you get on the phone with one of our coaches. All of the people in our office are trained and certified in this protocol, in doing this program. Everybody is on the same page doing this. So what we do is we schedule you what we call a discovery phone call, where you can get on the phone with one of our coaches. They will talk to you about what's going on. What are you noticing? How long has it been going on? Can you identify any triggers? And give you a very good idea of whether or not you're right for us and we're right for you. And here's how you do it. You can either call the office, or you can email the office. Just email admin at the Carroll Institute. Tell them you want to get a discovery phone call scheduled. Look, every day is important. Neurodegenerative problems do not stop, and they don't reverse without doing something. You've been told there's nothing you can do about this. That's incorrect. There are no drugs for this. And I can tell you there won't be any. And you might think that's kind of a bold statement. There are over 40 different things that cause the brain to degenerate and not work properly. Each person has a unique combination of things going on in their brain. It is not possible to design a drug that can treat a unique combination of over 40 different variables. You have a better chance at winning the Powerball or the Mega Millions lottery than you do of designing a drug that can treat each different person's unique combination in one tablet. It's not going to happen. So you either do something now, or you wait and get worse, and then try to do something then, and we hope that it's not too late. Every now and then, I had somebody just this last week. They came in 2 years ago. I said, this is what's going on and this is what we need to do. They came back in last week and I had to tell the son because the father is now too far gone. If things are changing and getting worse, don't wait. Do something now. Maybe you'll find out things are working great. Maybe a little bit of nutritional or diet change is all you need to do. But if you don't do anything, then you'll never know what you could have done to stop the degeneration. I hope this has been informative. And if you want to give the office a call and schedule a discovery phone call, we look forward to hearing from you soon. Have a great day. Bye.